Hi, everyone. Welcome back to the Mass Retirees Weekly Update. Today's Friday, March 11th. I'm Sean Duhamel. Thank you so much for joining with us and taking the time to tune in again this week. I am joined by a very special guest today. And before I get to introducing David Morales formally, I just want to remind all of you a little bit about why we provide these weekly updates, what we're trying to achieve, and what you can expect from this. Now, the purpose of these updates is not only to keep Mass Retirees members up to date on the latest events and breaking news, but it's also to keep you well informed. Our weekly email and video updates allow us to take a closer look at the issues that we talk about in our newsletter, that you may read about in the general media or in the press, and the issues that are impacting you specifically as a public retiree here in Massachusetts. Now, joining me this week, as I said, is a very special guest. We have Unicare General Manager David Morales with us. Unicare is no stranger to GIC enrollees. And in fact, even if you are a municipal retiree and you're insured through one of the municipal carriers, Unicare, I would imagine, is a name you've heard. You've heard me talk about it. You've heard Frank Valeri talk about it. You've seen the name in our newsletter. And if you've read our most recent newsletter, the March Voice, right on page 7, there's an article that we co-authored with Unicare on a particular topic called Whole Person Health, which David and I will be discussing in this video today. But retirees, I should also point out that among retirees, Unicare is best known for their optional Medicare extension plan, the OME plan. In addition, Unicare is the carrier of the basic indemnity plan. Now, if you're a non-Medicare retiree living outside of Massachusetts, the basic indemnity plan by Unicare is your only national option at the present time to make sure you're fully covered for health insurance, regardless of where you may live, where you may seek care. So they are an extremely important company here in Massachusetts. They're based in Andover. They have been a GIC carrier now for many decades, going all the way back to the old John Hancock plan, which has evolved eventually into what is now the Unicare plan. Now, David Morales has been a friend and colleague of mine for many years. In fact, I first met David when he was working in the State House on Beacon Hill for former state senator from East Boston and Senate President Robert Travellini. David then went on to serve in the Patrick administration in a variety of capacities, and he is now known as one of the leading experts here in Massachusetts for healthcare administration, healthcare policy, healthcare delivery, thought leader on everything related to healthcare. We are very fortunate to have someone of David's capabilities at the helm of Unicare. He's been a great ally of Mass Retirees now for many years. And David, thank you so much for joining with me today. I was wondering if you could provide a little bit of additional background about yourself, about Unicare, and specifically with Unicare, what makes Unicare different? You know, the retirees have a lot of different options under the GIC. Unicare is the most popular option amongst our members. Maybe talk a little bit about why and what you bring to the table that's different.
Sure, thanks. Thank you, Sean. And thank you and to your members for having me on today. It is an honor to be here with you today. A little bit about me, very brief. I am a local Massachusetts person. I worked in government for 13 years, live in Lynnfield, Massachusetts currently. In those 13 years, I was blessed to have worked for 2 different governors, Governor Swift, Governor Patrick, Senate President Travellini, former Speaker Tom Finneran, in various capacities, always focused on economics, the budget, and healthcare. I also served as healthcare finance commissioner, where I launched the healthcare cost containment processes that are still in place today under the Health Policy Commission. And I also was on the provider side for about 8 years. A couple of years ago, was recruited to lead Unicare, and it's been a humbling experience. So that's a little bit about me. Now to the important stuff, Unicare. So what makes us unique? Unicare has been serving the GIC for over 30 years. It is literally dedicated solely to support GIC members. That is really unique, number one. Number two, we're the largest carrier in the GIC. Over 50% of the members, both commercial and retirees, we serve. And we're really proud of that. So that's number two. Number three, we're in Andover. We're a local company. Sure, the others can say the same thing, but for a company that's fully dedicated to the GIC, to have all of its support systems out of Andover fully dedicated to our membership, that, by the way, are spread across the United States is pretty unique in itself. And then the final thing I'll say is we have customer service and member experience scores that exceed 94% annually. And frankly, it's one of the things that I'm really proud of. Our team's culture and our service to the membership and dedication is unrivaled. And so all those things make us not just unique, but frankly, what I consider the best health plan in Massachusetts.
David, one of the things that Mass Retirees has focused on now for a very long time, and our members are aware of this, is partnering up with whether it be insurers or in some cases the GIC and other private firms, trying to find innovative new ways, thinking outside of the proverbial box of delivering better healthcare quality services, finding ways to lower costs that do not involve simply cost shifting or rearranging the deck chairs on the boat, but finding ways to really better serve our members. And going back in time, we worked very closely with the GIC over 20 years ago now to create the first of its kind retiree dental plan under the GIC, which in 2002, when it was launched, it was one of the only retiree dental plans in the entire country. We've worked closely with Blue Cross and with Maya to expand Medicare enrollment for retirees who are traditionally non-Medicare eligible. We've worked with the GIC and Unicare to implement the EGWIP program several years ago that have helped substantially lower prescription drug costs for Medicare eligible retirees. And recently we began to have conversations with you and with your colleagues and your team at Unicare about the concept of whole person health. And that led to the article that's contained on page 7 of our newsletter. I should also point out that we have a teletown hall meeting that David will be participating in on March 25th at 1 o'clock. So if you're watching this video or you're reading the email or just listening to us and you have some questions, you'd like to learn a little bit more, tune in on the 25th. It's a members only teletown hall. So you have to be a Mass Retirees member to participate, but it's going to be very informative. But David and I wanted to use this opportunity to talk a little bit more in depth about whole person health, give you some deeper understanding of what it is, what Unicare is trying to achieve, why this is somewhat unique, and why this is different than maybe some of the activities that existed in the past that may not have worked out quite as intended. But David, just what is in general, whole person health all about, and what is it that you're trying to achieve?
Sure. It's a great question, Sean, and one that I get asked almost daily. So in order to answer it, I'd have to give folks a little background and context. Historically, healthcare has been set to treat illness, what I call sick care. And so hospitals, physician organizations, health centers, payers, health plans, we've all been organized for years, decades, to treat the illness. Sean gets sick, Sean goes to the hospital. Well, that's what we know about healthcare. That's how we set it up. And so you get the results you created. Someone gets sick, go get treated. Well, frankly, that's not the way it should work. And so the concept that we call whole person health at Unicare is flipping the model, working with hospitals and providers to say, time out. We should be working proactively to treat members' health, keep them healthy, help them engage in a conversation around their long-term health so that we are not waiting for them to get sick, but rather we are becoming their partners in their health journey from birth to post-retirement. And so the model flips very differently to say, how do we actually consider and understand that social drivers of health determine someone's health outcomes? What does that mean? Well, what that means is we have to understand where they live. We have to understand their health habits, their dietary habits, where they work. We have to understand their patterns. And so the health system has, over the last decade, become really, really, really better at understanding social drivers of care, the conditions that really influence our health outcomes. And so what we're doing at Unicare is bringing in a whole new model that proactively uses information, data, proactively engages our members to help encourage a healthier lifestyle or to engage members in support of a healthier lifestyle. It's a whole different shift in how we engage members. One tangible example is we have a digital platform called Sydney. We have a member engagement and nurses that will literally proactively call a member and say, hey, look, we're here for you. These are all the available services for you. If you need me, here's my number. If you want to use the Sydney tool to evaluate your claims experience, to look at your health, to look at your where to get your primary care services, et cetera, it's all there. I noticed that you had, an event last year. Is there anything you need from me? And so we're trying to be very proactive about engaging our members to help them understand that health plans are not just a silent actor. Health plans should be proactively engaging with the members and the providers as part of that health journey.
I think, David, we should be clear that this does not in any way replace sick care. If someone gets sick, someone gets hurt, those services are still going to be there as they always have. This is simply providing a supplement or an extra layer of care to hopefully prevent sickness. And
that's right. And let me be clear. Let me be clear about that, Sean. That's a good point. What we're doing does not change anything for the member. If anything, the member now has even more services available to them. But we are not changing the structure where if a member says, hey, look, I want to go see the doctor I want to go see, by all means, go do that. Mm-hmm. If you get sick, you want to go to the emergency room or an urgent care, by all means, go do that. But what we are doing in addition to that is bringing in a platform of health engagement that helps us understand what are the conditions that are impacting the member's health. And B, we have an entire team that collaborates with your doctor and your hospitals to say, time out, instead of waiting for them to get sick, let's proactively engage them and become their support toward a healthier lifestyle.
And that's one of the things we hear from members, that all of this can be very confusing. Trying to navigate the system's confusing, trying to read the materials that come in, after you've received care can be confusing. Knowing what to do to follow up and to keep yourself healthy and keep yourself out of the hospital, all of these things can be confusing. So to have professionals available who our members trust, and Unicare is a long-term, as we said, 30 plus years of experience with the GIC, as a trusted brand that our members feel comfortable working with. So thank you for what you're doing, and this is certainly going to be innovative. And one of the key things for mass retirees, and I think David shares this point of view, is we simply don't want to just keep shuffling paper and maintaining the status quo. Year over year, these benefits are becoming more and more expensive. Our members cannot afford to continue to pay higher prices all the time. At the same time, we want to make sure that we are maintaining the highest possible quality of care, that you're not being nickeled and dimed, you're not being told no when you need critical services. And one of the ways for us to collectively go about making these changes is simply by keeping people healthier and giving you the resources and the information and the help that you need and some of the guidance, and maintaining what's known as continuity of care. That is simply not just going to be delivered when you get sick and you show up at the emergency room. That many times, I don't want to say it's too late, but we've already, the horse has left the barn at that point. So, David, in terms of what this means to members, and are there proactive steps that someone could take, or an example of how they can engage with these types of things rather than just waiting for a phone call or a letter from Unicare? What can a member do on their own?
Yeah, look, there's several things. First and foremost, we have a fully dedicated Medicare extension number that the retirees particularly can call. We have a 24/7 nurse line available. Any questions, any concerns they have, they can call our nurses anytime and talk through their health options or health issues. That's available for them right now. We're never going to change that. That's important for the members. Number two, we have a social worker that our members can connect with at any time, whether it's dietary issues, whether it's financial issues, whether it's cost of living issues. There's somebody to talk to, right, that can maybe help think through some strategies for members around that. We also have digital tools. They have access to Sydney Health, which is a remarkable tool that helps them to evaluate not just their claims experience, their costs, but also some of the provider access they have. There's also a new tool we're going to launch next week. It's called Title Care. And this is another option to help make life easier for members. So with Title Care, essentially, members are going to have access to a home-based kit where they can self-diagnose. It's a low-cost option. We've gotten a really big discount from the manufacturer. And for Unicare members, a kit's typically about $150. So you're going to get a camera, thermometer, otoscope for your ear, stethoscope, a tongue depressor. Essentially, we're trying to make things easier for members. And then you can literally log on to Sydney or call your doctor via tele, et cetera, or our nurses and engage and say, hey, look, I'm checking myself out. Here's what I'm finding. We're trying to engage members to think about their health proactively.
Mhm.
So those are things that tangibly members can expect when they sign up with Unicare, or new things that we're bringing to the members to help their health journey be a lot easier.
Excellent. As I mentioned before, David will be joining us on Friday, March 25th. It's in fact just 2 weeks from today, believe it or not, at 1 o'clock. So if you are a Mass Retirees member, please join us. And even if you are not enrolled in Unicare, a lot of these things are indicative of what's going on in the healthcare marketplace in general. And it impacts everybody. As we always say, what happens at the state level with the GIC very quickly becomes local policy as well. So everybody is truly in this together. So I encourage you, if you are able to join us on the 25th at 1 o'clock, please do. David, again, thank you so much for taking time this morning to do this with us and engage in your partnership over the last couple of years. It's a pleasure to be working with you again, and really looking forward to seeing where some of these things lead going forward. But I'm going to give you the last word, my friend.
Sean, thank you. We honestly, it's simple. We're honored to serve the members, and we are totally humbled that members continue to choose Unicare as their health partner. So thank them and thank you for supporting us and for allowing us to serve you.
Great. Thanks again. Take care, everybody. We'll see you again soon.